Prenatal stress and childhood mental health. New research reveals long-term effects. Introduction. A growing body of research continues to affirm what many expectant mothers may already sense intuitively. Stress during pregnancy doesn't just affect the mother, it can have long-lasting consequences for the child as well. A recent study from the Avon Longitudinal Study of Parents and Children, ALSPAC, reveals a concerning link between maternal stress during pregnancy and increased markers of inflammation in children, as well as elevated risks for anxiety and depression later in adolescence. This evidence underscores the biological and emotional sensitivity of the prenatal period, highlighting the critical need for comprehensive support systems that prioritize maternal well-being. As we uncover how deeply early environments shape mental health outcomes, these findings offer both a caution and a call to action. The study, a closer look at long-term consequences. The ALSPAC study analyzed data from 3,723 mother-child pairs over an 18-year span. Researchers specifically looked at the correlation between maternal stress levels during pregnancy and biological and emotional outcomes in the children. One of the key findings was elevated levels of an inflammatory marker, interleukin-6 (IL-6), in children at age 9, which was more common in those whose mothers experienced significant stress while pregnant. Elevated IL-6 is a biomarker often associated with chronic inflammation, a physiological response linked to numerous mental and physical health conditions, including mood disorders. While the study did not find a direct mechanistic pathway between IL-6 levels and later depression or anxiety, the association between maternal stress and these outcomes was strong. By age 16, children of more stressed mothers were more likely to experience intense anxiety symptoms. By age 18, they faced a heightened risk of clinical depression. What's especially notable is that these outcomes persisted despite controlling for various socioeconomic and genetic variables. The implication is clear: prenatal emotional environments, specifically maternal stress, can lay the groundwork for a child's later mental health trajectory. The role of cortisol and the developing fetus. When a pregnant person experiences chronic stress, the body produces elevated levels of stress hormones like cortisol. These hormones are essential in short bursts, helping us adapt to threats. But when persistently elevated, they can cross the placenta and influence fetal development. This prolonged exposure can disrupt the regulation of the fetal immune and nervous systems, contributing to long-term changes in how the child's body and brain respond to stress after birth. Fetal programming, a concept widely studied in epigenetics and developmental biology, refers to how environmental influences during pregnancy can shape gene expression and health outcomes in offspring. Prenatal stress may essentially prime the fetus for a heightened stress response, potentially creating vulnerabilities that manifest as anxiety, depression, or immune dysregulation later in life. Inflammation, brain development, and emotional health. The finding of increased IL-6 levels at age 9 aligns with growing evidence that inflammation plays a significant role in mental health. Chronic low-grade inflammation has been implicated in depressive and anxiety disorders as well as cognitive difficulties. Although IL-6 was not shown to be the direct cause of adolescent mental health issues in the study, it may act as a marker of early biological disruption that reflects a broader imbalance caused by prenatal stress exposure. It's also important to note that the developing brain is particularly sensitive to these changes. Brain regions such as the amygdala, hippocampus, and prefrontal cortex, all involved in emotional regulation, memory, and executive function, are still forming during gestation and early childhood. Inflammatory and hormonal changes can alter how these structures develop, increasing susceptibility to mental health challenges later on. The importance of supporting maternal well-being. Experts increasingly advocate for early preventive interventions to support expectant mothers, particularly those in high-stress environments. This includes access to mental health care, prenatal education, mindfulness-based stress reduction, adequate social support, and safe, stable housing and nutrition. Integrative care models that include emotional support, trauma-informed counseling, and prenatal stress screening could be particularly beneficial. These approaches help mothers feel seen and supported, reducing the risk of adverse emotional and biological outcomes for both mother and child. Moreover, public health policies that ensure access to maternity leave, affordable health care, and community-based wellness programs play a vital role in reducing systemic stressors that disproportionately impact pregnant individuals in lower socioeconomic groups. Conclusion: the findings from the ALSPAC study reinforce the powerful connection between prenatal maternal stress and children's long-term mental health outcomes. Elevated stress during pregnancy appears to alter inflammatory processes in children, which may contribute to an increased risk of anxiety and depression in adolescents. Although more research is needed to fully understand the biological pathways involved, the evidence is strong enough to support a proactive approach, ensuring expectant mothers are cared for emotionally, socially, and medically. By investing in maternal mental health today, we may be fostering more resilient, emotionally healthy generations in the future.